Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Haidar Al-hakim, the Third Eye Doctor. Pull up a chair and get ready for some candid and uncompromising discussion with experts, innovators, agitators, and influential people from every corner of health and well-being. From inside the hospital to at home in the kitchen, we're leaving no stone unturned in our quest to uncover the secrets of healthier, happier, more successful, and less stressful lives. Thank you so much for joining us, and without further ado, let's meet this episode's guest. Hi Diana, how are you?
Good, thank you. Good morning, good afternoon to you, evening, because it's getting dark in the other side of the pond.
Yeah, I mean, this technology is great because, we can speak to anyone at any time. But it has its disadvantages, which is, you can't be in a real studio face to face, and you can sort of feel the energy and the vibes of the other human being in the flesh, which is what I like about medicine, really, because you actually see another human being there, and you can feel it. You can feel the other human being.
Yeah, I agree. I think there's definitely a benefit for any in person, but I still think with video, you can feel the energy. And even with audio only, you can sort of kind of hear in between the lines, little inflections, little things that clue you to the energy. But I do agree. Yeah, person is always nicer, and you have the ability to always, be close, touch them, hug, all that, fun stuff with patients or family or friends. But, second best is video, and it's still, good, and gives us the global ability, that you can just see people all the time, anytime.
Yeah.
So I do love that.
I mean, the thing that frustrates me about, I don't know about you, but when I have angry patients or frustrated patients, I kind of feel that a lot when I'm sitting there, and it makes me angry and it makes me frustrated. So
Yeah,
I'm getting better at it. I'm realizing that they're angry and they're frustrated, not at me. I mean, obviously to a certain extent they are, because of whatever situations happened before they come and see me. But I realized that it's not directed at me personally, so I don't have to get too angry and frustrated with them. How do you deal with that? What's your kind of go-to place?
Yeah, I think there's a few things I do, because I think sometimes we're a little bit of empaths. We feel the energy, and then we start feeling it ourselves in our body. Like we either start cringing, or we start kind of reacting, or we want to kind of like, get mad back, or we just start feeling in our neck like, oh, and we feel like a resistance almost. But I think over the years, I've kind of a little bit better. Sometimes when patients, if they're upset, I mean, I really just kind of visualize almost like a little Pac-Man that is kind of biting and kind of chewing like the energy coming my way, just to sort of block it and keep it on their side. I'm still able to, make them feel hurt, because most people, when they're angry, whether it's a patient or myself, you're angry because you feel there's an injustice. You feel something is not right, and it wasn't fair, or you're frustrated because it didn't have the outcome you wanted. So that's why you're angry. And of course, yeah, maybe not you directly, but maybe it's like how long it took to get an appointment or something. Something's not fair. And I think in those situations, for me, I just really try to get curious and ask, to tell me more, like, tell me what's going on. And then I'm like, I hear you. I absolutely hear that is not fair. It took a long time to get to see me, and you were suffering, and you're in pain, or you're frustrated, or you're confused. I hear that. But then I'm here now listening, and I want to take care of you and do the best for you. So I really want to get curious, dive in a little deeper, acknowledge what their source of anger is, and then really say that I'm there, that like, let's move forward and go from there. And usually, when people feel heard and listened to, I think that really brings down, like the volume or the energy that is, a little bit aggressive. But I think people want to be heard. I mean, whether you're angry or not angry, you can just come in for an appointment. I mean, you want your physician to listen to you, and not just like superficially, but like a little bit deeper. And I think that's the magic. When we're really with patients, we have to be present and also not get wrapped into the vortex as well, because then it doesn't help anybody if we just jump in there with them and also get angry and start yelling back, because it doesn't go anywhere. So, you can be present, keep some distance of not bringing that in with you. And then when you pick out a little bit, which I do at times, I mean, I literally like will dance it off, shake it off right after. I'll be like, because I don't want to keep that in, because it's not my energy and it belongs to them. And I didn't send them kind of like love and compassion, but I don't want to keep it on me.
And could you tell us of a time when you sort of jumped in with them and
Yeah, I mean, yeah, it's
or are there too many of them?
no, there's not too many, but it's just, when I start feeling, a little bit tense and I'm like resisting, the outcome is never great. I mean, I had a patient recently that, came in and it was for like an elevated PSA prostate, test for, screening for prostate cancer. And, he was, just really calling passionate and, telling me about all the research he did. And he just wanted to tell me to do this, to do that. And that's fine. I mean, I always appreciate, I actually appreciate when people like read about it, they ask people, they come with questions. I mean, I appreciate that. And I don't have any issue. And I also always even encourage second opinions. Like, you have to be sure, you have to trust me of what we're doing. And if you don't, I definitely, they have to go to second opinion, because if you don't trust me, then it's not going to work. It's not a good relationship. And I'm very open about it. Like, you have to trust me. I have to trust you that we are in a relationship. If a patient does not trust me, they really do get, like I said, that second opinion. But yeah, in that instance, I mean, I was feeling like this resistance, and I mean, I did acknowledge it, and I was very vocal. I said, I'm feeling like there's not a trust, and I'm very open. And at the end of the day, the patients have to decide what's best for them. But yeah, I mean, I was really feeling like really tense, and I had to just, acknowledge the elephant in the room. And then it's just, like I said, up to them. But yeah, it happens. I mean, there are people in different places, and, they're trying to control something and they have fear. So some people, having all this information is a sense of control, because like, it's a scary thing. Like, you don't know what it is. So you want to know everything, in a way to control the outcome. And you're not sort of trusting or letting the process be. And again, it's about trust. And if you don't trust the doctor, the relationship is never going to work. Because a lot of what we do, it's about trust. And a little bit it's like about, let's call it placebo. I mean, when you go to a physician, just the trust you have in them will going to make you feel better. The trust that they know what to do, you're going to feel healed and better, whether you give a prescription surgery or not. And we know that a lot of the stuff we do, even the ones that have been studied in medications that, maybe 10 years ago, they weren't working, and then we flipped the script of how that was the best medicine for this. And now we know it's not, but somehow they felt improvement, 10 years ago when we thought it was the best thing, and now we know it's not the best thing. So how can that be? So the thing is that when we put our belief and our trust in that something's going to work, we're so powerful that it's going to bring that healing. So again, it kind of goes back to relationship. If you trust me, it's going to be okay. But if you don't, I never operate on any, those patients. I really don't, because it's not going to have a good outcome.
And where does trust in yourself come into the equation?
I mean, I think it has to be centered. I mean, it has to be trust and love, self-love. Well, like self-love that, for example, like, like a little bit boundaries too. Like, I don't put up, let's say, with patients that are not going to be like kind and loving to me, because I'm kind of loving to them. And if they're going to be attacking me or, not being kind of loving, that's also, again, a relationship that I'm not going to put up with. I really have firm boundaries. If you're just disrespectful to my staff, I mean, you've got to go. Like, it's not how we work. You can't be kind to me and disrespectful to my staff. And again, that's a time to get a second opinion with somebody else. And it has to be trust that, like, I am deserving of respect, one, that I'm doing the best I can. in everything I recommend, that it really comes from a place of love and care. And I'm putting my 100%, to you, in that moment. I'm not thinking about all the things I have to do. I'm being present for you. So it has to come with a trust that I'm doing everything for you with the best of my abilities, right? Because we're not perfect, but in that moment, with all the tools that I have, I'm making the best decision for you. So it has to come from trust that I'm doing the right thing, that I think I'm worthy of this, and that. And then, then you project it to others, but it's a full circle.
Have you always been that way in terms of self-loving and self-trusting, or was there a process that you had to go through in order to develop that?
I think, I've always been very curious sometimes, you know, that I see a lot, especially women. I see a lot of women like with their self-talk that is very negative, or about their body. And it's not about this size. It's not because, oh, I'm skinny and then I love myself, or you're fat, bigger and you don't. It's not about size or what you look like, because everybody can find some defect, let's say, or something they don't like. You can find plenty of people in Hollywood that you would think are perfect, whatever that means, and they like self-loathe, to the max. So it's not about that ideal. It's just about like loving yourself. And I really, for as long as I can remember, I've always felt like, I really like, I don't have a negative self-talk, like, oh, I don't like this, I don't like that, oh, I'm too poochy here, I'm too, this, that, or the other. And I see a lot of women that don't have that. And I always wonder kind of why not, or like, why do you have this self-deprecating self-talk? And I'm still trying to figure out the whys. Like, why is there a difference? And I don't know,
What
but it's
kind
just
of
something that I have.
inclinations do you have, sort of ideas of where it could be, the kind of nebulous areas that why this is the case?
I don't know. I just have like a deep knowing, like a deep, it's just like, it seems like obvious to me, but and I don't know what the source is. I guess if you can call it, you have a connection to some, like a higher source, is like your inner intuition, a connection that is deeper that maybe you didn't know the language for before. And then slowly perhaps you're realizing the language of what that is coming from. But I don't know why I always had that knowing, since I was younger. And I don't know why some women really continue to have a negative self-talk about themselves. And then it reflects how they then treat other women, because it may or may not be surprising, but many women, instead of being uplifting, supporting, like, wow, you look fabulous, they're very competitive, or they're like, they're not supportive, they don't elevate other women, and they're very much the opposite. And I don't, why, but I think like if your own talk is not loving, it's very challenging to do that for other women or for a man, obviously. But I see that a lot, but I do think slowly it is shifting, and women are really embodying their like divine, their God as their femininity, and really uplifting each other a lot more, which is really uplifting to see, actually.
And did you experience any female role models within the medical industry that actually embodied this
Yeah, that's a great question.
celebration of the feminine within the medical industry, or is it very few?
Yeah, I don't think I had I think for role models per se, I think in medicine, I don't think I had either male or woman very much, really. I didn't have like a mentor or things like that really was like, oh my God, I want to be like them, or they embody that. I think a lot what I saw, especially because I'm a surgeon, was more the opposite, like women that did not celebrate their feminine, that didn't sort of take care of their femininity, and it's not about wearing lipstick or high heels, but it's just embodying that feminine side, that feminine leadership, compassionate. It was more like, let's get to the goal and let's be number one, and let's not talk about like feelings. It's not that women talk about feelings, but like that nurturing side, that softer side, again, the feminine. I didn't see that. I saw more of a, let's not like talk about it or show it somehow, let's kind of hide it, let's be more stoic, masculine, in a way. That's what I saw. And is that something I knew like I didn't want to do, because it's not who I am or who I feel I want to be, but I saw more of that, honestly.
And how did you keep your feminine side going during these times?
I think it's just about, being you. Like, I think it's, not even if you know, go through anything, it's like you can't be a chameleon, like try to please this person and try to adapt and be like them and like, so they like you and the other person likes you. It's like, I think you just have to be you. And so no matter what you go through, whether it's surgical training that would be more, let's say, masculine energy or not, you have to be you no matter where you are. And then that way you don't get lost or confused or spend so much energy trying to figure out like, oh, what am I supposed to be like? Because it's just you are you no matter what the setting. So I don't think, it changed me. And I remember even, I mean, I always kind of have been like this since I was very young. Like, I wore my heels or this or that, and even they would laugh at me like, "Oh, I'm sure you won't be wearing that when you're attending or this or that." And I'm like, "Well, I still do. I still show up and I cut my hair and I do that. That's just who I want to be and have been throughout, because I embrace that part of me, and it hasn't changed as I went through. I just was always like the same, no matter what setting I was kind of put into."
And where does this amazing energy come from? What's the source?
I mean, I think part of that, I mean, like I said, I don't think the mentorship was through medicine that I saw, but I think it's a little bit cultural as well. I mean, I'm Mexican, and Latina women tend to be, it's a little different. I mean, my grandmother was like, in her 90s when she died, and she still, to the day she died, dyed her hair black and, had her all combed. And when she would go to the grocery store, I mean, it looked like she was going to a party. She was very fancy. She was very elegant. And no matter how nice I look, she's like 100 times more elegant than I could ever be. And so I saw that in my grandmother. I saw that in my mother as well, always having like that elegance, and really, embodying that. So I think from that is where I probably got it from. We tend to wear jewelry and earrings and, at least try to do a minimum of like always wear a little earring to really kind of embody that sort of femininity part. And that's a little bit cultural, that women tend to be more always, in that sense, embodying that a lot more in the Latin community. Again, it's a generalization, doesn't apply to everything, but I think I got that from looking at these women in my family who really embody that till like the day they died, really.
And it helped you in your profession, would you say? Did it sort of give you some extra what's the word? Extra points or I don't know
Well, I
what the
think it could be a
American
double-edged
terms
sword.
is.
I
Yeah.
mean, I don't know if it's any extra points. I mean, I think when you show up confident, I
Yeah.
think as a woman, other women feel threatened. So, I think some women probably didn't appreciate that one. And even, I remember I was interviewing, I think was it my first job, perhaps, and I met with like the chief of like some very prestigious department, blah blah blah, and he just looked at me in the interview like literally up and down and said like, well, I mean, why do you even want to have this job? I mean, like, like kind of like, you're too pretty, you have a good your husband has a good job, why do you even like, why are you here, kind of thing. And I was just like, really, buddy? I mean, this is interesting for sure. So, sometimes when people look at you a certain way, they make up their own judgments of what they think you should be or not be. And again, like
Well,
that's
what did you say back to him?
well, he looked at me like that and said, "Oh, I mean, I just said, no, I mean, that's great. My husband is successful, but, I'm here for this job, but I definitely did not even, I did not take it. I would never take it when a chief, the leadership of a department is, has that attitude. I would never work, no matter even how much money you would give or prestige the job would have. I would never take that job. And I did not. Because I don't want to work with an environment that has that belief system. So yeah, that definitely was a very gracious gift to be able to see sort of his beliefs. And I'm like, oh, no way, I'm not touching that with a 10-foot pole. But some people, take the job and took the job, and they are like begging to be there because it's very prestigious and this and that. But absolutely not. I mean, I'm not going to be, part of that, or listening to a chief be demeaning to women or their achievements, and just pawn it off to like, oh, the husband, as well. So why would you, have a job?
Yeah,
Yeah.
yeah. And what got you interested in neurology? What was the interest there?
Urology, well, yeah, there's not a lot of women. We're 10% that are women in the US, maybe different in other countries, but I even know in Colombia, where my husband's from, the whole country had like six urologists that were women, and most of them did pediatric urology. So there's not a lot, but it's a great field. And to me, I mean, I like surgery, and it just really went down the path of, which one I liked or which personality I liked the best. And I really do love, old men. Like, old men are my favorite. And so I was like, sign me up. I mean, this is all my patients are older men. And
Why?
it's just,
Why older men? Why do
they're
you
just
like
so
old?
fun, and they're so cute, and they're just adorable. And I just, oh, they're so cute. I just love them. They're like, oh,
Where
they're
does
like
that come from? Come on.
I don't
Yeah,
know, but
cute.
they're so cute. They're just so adorable. And I don't know, they're fun. But really, urology, I mean, as men and women, I don't see as many women, but it is very rewarding to see patients for like long-term, and some specialties don't have that, like a general surgeon. You take out the appendix, you never see them. But some of my patients, we just celebrated 5 years cancer-free since I operated on them. And, it's just fun to see their evolution, their grandkids, their kids. And I do have some young patients too, obviously, but it's just fun to see them long term, and you know, do surgeries, but also treat them medically, and it's a little bit of a combination. And so I
Yeah.
do like that it's not only surgery and not clinic, and you can always pivot, and you have the ability to do big surgeries, or like smaller outpatient surgeries, or combination, or all of that. So it's interesting and it's different. And there's a lot of preventative things. There's a lot of quality of life. I mean, there's a mix of all of it. And it's not like too depressing. It's not like some specialties are, all depressive, cancer things and diagnosing kind of heavy, but it's a little bit mix of everything.
Yeah, but you see sort of old men penises. That's not so, I don't know, is that fun?
I mean, it's like, yes, I've seen a lot of penises. Yes, I'm an expert on that. But I
But
think,
old men penises, they're all a bit they
but
they
I
stop
think
working and
Yeah, but then you fix them. So there's like magic.
oh
You help them, you fix them, you help their quality. I mean, that's what we do, right? We help them get an erection. And, you talk about things that are important because, men, if, when they have problems with erections, I mean, society ties so much of their worth to their erection. So if their erection is not there, like their self-worth just plummets. And I think it's important to, like, and also like if you don't have good erections, I mean, your sex life does not have to end. I mean, like, penis vagina sex is not the only type of sex you can have. There's so much other stuff you can do and use. So, our society just puts so much emphasis in like the fact that if like you don't have an erection, your worth is gone, one, and two, that there's no other thing you can use or do to have a great like relationship, intimacy, or sex life. So I think it's, nice to be able to also tell men and say like, you're worthy. Like, you're not broken because your penis doesn't work at this, stage in your life or whatever. And I think that's important to say, and not a lot of people will. And I don't know if another male colleague will say that to their patient, in a way. And I think in a way my voice is unique, that I can say that in like in a loving way, because when men come, yes, of course they're worried, but at the end of the day, deep inside, they sort of want to know that they are worthy, and they are, still, okay, like there's nothing, like they're not worthless at this point in life, because again, we tie so much worth to a man with an erection. It's just really interesting. As a society, we do that all the time.
yeah, it certainly helps when it comes from a beautiful woman, as a man. And I think you're in that sort of ideal situation where yeah, you can raise a lot of hopes for men around the world. So
Well, it's just, I think we all
it's
have,
awesome.
yeah, I mean, it's like for man or for women, for this, I mean, for women too. I mean, there's so much stigma, like, that they're not sexual active, or how much sex they should be having. And, there's so much stigma too, like, it's also to tell them like, you're okay. You don't have to have sex every single day, 5 times a day to be worthy, or have painful sex, because as women age and they're in menopause, if they're not taking care of their vulva and it's dry and it's painful, nobody wants to have sex. But then they're told by society, and by some expectation, that they should be having sex, and they're broken and not normal if they're not doing that every single day. And that's not the reality. So again, also to tell that to women is really important, and to say, it's okay. Like, you are worthy not to have sex every day. There's nothing wrong with you. You're not broken either. So I think that's important. And whether we're talking about sex or other things, I think that there's that kind of power of like, healing with that, like you talked about the presence in person, but, whether in person or virtual, I think, telling people, it's okay, and just being present and listening to their fears. Again, yes, when you come as a man with erection problem, there's a fear below that. Even a woman, like there's a fear, I'm not enough, or even like an exam, like, I show them their dental air with a mirror, so they know where to put their creams and things like that for treatment. And so many women are like, they don't want to look, and they're like, embarrassed and this and that. And it's like, it kind of goes back to the question about like self-love, and like, do you look at yourself, man or woman, in the mirror every day, and really not narcissistic, but like just say like, I'm beautiful. Like, doesn't matter if you have the stretch marks, doesn't matter if you have like the crow's feet. I mean, that there's beauty in that. You don't have to hide it and say it's shameful. And so it's like about loving yourself no matter what it is. Because again, we all have things, like I have a little, stretch mark here. I mean, I have children, so I don't hide that. I'm not embarrassed. It's part of me. And I think we just have to embrace our beauty, without the superficial, but there's inner beauty, because this is just like the little package. And yeah, you can have a great package, and that's great. That gets you for people to buy your package, but what's inside is the most important. This will fade or get different looking. And that if all your worth is this outside, that's going to be changing, and then people may not like that. But what they really, hope they like is your inside, like your true light, your true love, that presence. I think that's the most important one.
And how do you kind of cultivate this sort of inside self love?
Yeah, I mean, sometimes I think, when I was little, a child, people were very loving and always, for example, told me, "Oh, you have beautiful eyes. Oh, how beautiful your eyes." And when I was little, I mean, obviously I say thank you, and I still do, because people are very kind, and I appreciate the compliment. But it always made me think when I was little, which is odd, but I was like, well, if I didn't have eyeballs, would I still be beautiful? Because like, it's not my eyeballs, that, I was like, that's interesting. So if my eyeballs were gone, would you still say that to me? If there were a different color? Because obviously in Latin America, there's not a lot of people with light eyes. So, it sort of stands out. So I just had the thought, and then I guess I probably made a decision, like, it doesn't matter my color of my eyeballs. Like, it's like, that's not where my beauty is. Again, it may get you in the door. It may get you, maybe that interview, or people would like respond better. Because we do know that reality and the studies show that people that look a certain way may get, more of the interview or more of the job just because of the outside. But at the end of the day, if you get that job, you got to back it up with something else, right? Like your brains, your work, your inner something. So yeah, it'll get you somewhere, but there's more to that to really be kind of like a long lasting, thing where you have some depth and some substance.
Yeah, yeah. And you like this whole notion about sort of human first, rather than sort of any other thing. I mean, what makes the human being so unique? What is it about us that you attach love to?
Yeah, I mean, I think it's,
I hope
we're
that's not too deep.
no, it's like, we're imperfect. We're a journey. We all have like so many imperfections, and so many, like, everybody triggers us in different ways. And so we're all trying with our own traumas and triggers and things to try to like navigate this, and, try to, kind of work together, work alone, whatever, and try to figure it out. Like, right, at some point, some people may get to a point where they say, well, what's the purpose of all this, right? Like, why are we here? Some people will never maybe get there, and that's okay. There's no judgment on that. Some people just always want to get and accumulate and get the status and the accolades and the diplomas or the money or the fame, and that's all. That's like the purpose. Like, there's nothing else, just money, or whatever. And that's, people have their journey. I'm not judging that's good or bad or whatever. It just is. But then there's some people that may just think about, what are we here for? And I think we kind of get at different stages. There are these gifts like called burnout, and then you pause and think about like, whoa, what's the purpose of why am I here? Then there's like cancer diagnosis, or there's a death, and these are kind of big stop signs where we get kind of like a wake-up call and say, okay, like, are you going to pay attention? Are you going to pause and think about these deeper meanings, these deeper reasons why we're here? And are you going to do it or not? And so I think these are fantastic gifts we get. I mean, I got burnout twice, and it was a great gift to really stop and think about it, to really spend time to quiet down, to really dive deeper, into just not more than coaching and awareness. That's important, but like deeper. And then we start seeing like all the magic of, abundance in the universe and our interconnection. And again, how we're all trying in our best of our abilities, but we're all like flawed and triggered and traumatized and this and that, but we're all trying. So let's be, loving as much as we can. Let's be present for others, as we go through this journey, because it's really short. We're going to like die at some point, we don't know when. But if you're like at 40, I'm 42, like, there's maybe 40 years and that's it. So let's try to live every day to do the best we can. And it doesn't have to be some big thing, but every day you can be kind. Every day you can be present. Every day you can be compassionate to the checkout girl at the grocery store who's having a bad day, and you can be kind to her and you can make a difference. You can do little things every day that doesn't have to be becoming president or something huge, but it could be your scaffold to, a better place for others and for yourself.
Tell us about your first burnout. What happened?
Yeah, my first burnout was different. It definitely, I got to a place where my brain was very foggy. I couldn't decide what to do for a patient. Like, I'm a urologist, so, we put catheters all the time, little tubes so you can pee. And I couldn't decide if I should put it on this patient that had a complicated history or not, because he had an artificial sphincter. So anyway, I didn't want to compromise the sphincter with a catheter, and anyway, I just could not decide. And then I was like, this is ridiculous. I mean, I do this all the time and I can't decide. And it seems like this really complicated decision, and it's not. And so I thought something's definitely wrong. I mean, I must have like maybe a diabetes, maybe a thyroid problem. Something is wrong, that my brain is foggy and I just can't think. And I'm just like, and so I went to the doctor, and then, he basically said, here's your Zoloft, this is what's going on in your brain, this and that. And I'm like, what? I was like, check the sugar again, check this out. And it wasn't any physical thing. It was just my mind with the chronic stress, just spinning and spinning. And, sort of that hierarchy of like burnout, you can start with anxiety, apathy, then, you kind of freeze, and then you can collapse, right? Like you're just collapsed, you're not going to get up. So I wasn't there yet, but I was probably getting there. I went on my Zoloft, I went to therapy, and I definitely, got better and got off of my meds in therapy, and it was very helpful. But I didn't really kind of have any practice or anything different going forward after that. And so the second time was actually a lot different, and it was the chronic manifestations of stress, like in the body. So stress is really powerful. And I think even before I went through it, I didn't really think about it, believe it, address it even with my patients at all. But stress is so powerful, and how we put our attention or intention to things really colors our disease or our wellness. So for me, I had, insomnia, I had reflux, I got asthma diagnosed, which is crazy at 42. I had chest pain that was debilitating. I began to have joint pain. So then my rheumatoid factor was elevated, which is an autoimmune disease for rheumatoid arthritis. And it was all like an energetic bomb in my whole body. And, it was very different. So I had to basically change what I was putting my attention to, my intentions to, what I was focusing on. Was I stopping that fight or flight response every day and scheduling time to, calm down and bring down all that stress? And I didn't change anything except my thoughts. And I don't have any of those things anymore. And I sleep well, and I don't have reflux, and I'm not taking meds for that, and I don't have chest pain, and all this stuff. So it's really powerful. And we know that 80% plus of doctor visits, also going to specialists and primary, are stress related, and that it really affects our health. And I see obviously the bladder and this and that, how it manifests, but like stress causes your overactive bladder. And if you don't address that, it doesn't get better long term. Yes, I can give you medications for your bladder, this and that, but like you have to address the greater problem, because they're also going to the 5 other doctors for their palpitations and their, bloating and intestinal problems, because it's all stress related. And, we want that pill, we want that doctor to tell us this will fix it, but you kind of have to do the work and, change something to decrease that stress.
So what was the underlying stress, and what did you change in order to overcome
Yeah,
the
I don't think
stress?
there was anything specific that was the underlying stress, but obviously, it was COVID and the COVID fear. I know we talked about it before, how you dealt with it and how you were very calm through it. And I think I was completely the opposite pole, but I was, in a state of fear. My fear scale was like off the chart. So it's just more like the fear. So then it wasn't like a stress, but it was a fear. When you're in fear or stress, whatever, either one, your cortisol is like off the hook. And then for me, it was like the fear of COVID, of like, I'm going to die, what's going to happen, more with that. And, going on Facebook every morning or at night, reading for like an hour the news, which is absolutely not helpful at all. And so I don't ever read anymore, any of that. And I spend time in, meditation or other things in my morning or my night, or doing gratitude journals instead of like reading the news, because it wasn't helpful at all. And it was just putting me in a state of stress, alert, hyper vigilant state. So that was, for me, it wasn't a stress, it was more like a fear. And it's still activating the same response where your cortisol is like, going off the hook.
And this was a fear of loss of life for yourself and the
Just,
consequences of...
like what's going to happen. Like we didn't know, anything about it. You saw, doctors just falling and dying from like, the ER doctors that just died and they're young. And, are we going to get a vaccine, or what's going to happen to us? People get intubated. As an empath, I just started reading everybody's story, as I started reading everybody's fear, and like it just got amplified in me, like their fears, their what they were seeing, what we didn't know. So I was just kind of picking up all this sort of energy, like you said, like you pick it up with angry patients. Well, I was picking up everybody's fear and not protecting it and kind of separating. That's theirs, is not mine, but it just got amplified. Mm-hmm.
Yeah. And how did that break? How did you break that? You mentioned a few things, but what was the kind of the turning point for you?
Yeah, I was just in a negativity vortex. I was very negative. I was just, everything's terrible. And so I was really circling in those thoughts. And, my husband said, you really are acting like somebody at work that, you work with, that is, sort of Debbie Downer. And I was like, what? No, what do you mean? And then I kind of rolled my eyes and I turned around, and then I was like, oof, that's awful.
You didn't strangle him, did you? You didn't. Yeah.
I didn't strangle him, but I was like, no, but and then I'm like, oof, that kind of stung. That's awful. That's not fun. And then I had to think about like, well, do I want to be that? Am I that? And I definitely was. And then I'm like, I'm not present for my kids. I'm not present for anybody, because I'm just like, Debbie Downer. And I'm just in stress mode. And so what am I going to do? So, for me, I started like getting into coaching, listening to podcasts about it. I became a certified life coach. And that's step one, again, about awareness. You have to be aware. You have to come out of victim mode, and that's a huge kind of step for a lot of people. Are you a victim, or you're a creator of your reality? And are we going to blame everybody for everything? Or are you going to take some radical responsibility for things? And that's huge for people to get out of that. And that, again, coaching can get you kind of to that step. But then later it's diving deeper to like spirituality.
But how did you come to that realization that you need to take radical responsibility? What gave you that? Was it something that you knew before, but you did take the steps, or?
No, I think I did not know that at all. That was definitely something that I learned, and I mean, it's kind of part of like coaching in some ways. So some of it,
Mm.
it's not spelled out that much, but it is part of it. But yeah, I just have to be like, okay, yeah, I'm responsible. I create all this. And so yeah, I had to be like awareness, and I started reading a lot. I used to read a lot when I was younger for fun, and I kind of stopped reading, except medical stuff, of course. But I
What sort
started
of
reading
things did you read? What sort of things did you read that
kind of
really?
everything. I mean, like I started diving into like the kind of neurochemistry, what happens in your brain, like Buddha's brain, just like just different books about like what's happening in your brain, uh, everything and anything, like about things about intuition and things about like spirituality, Eckhart Tolle. I mean, like all kinds of different things. Some books about like empowerment and women. This, I mean, different things, but just kind of getting a breath of like going deeper into what's really happening in the brain, things about mindfulness, and some kind of coaching principles, things like that. So, just kind of getting more educated, kind of opening your mind up and getting new ideas about everything, kind of making the connections of what's happening. What are the manifestations of stress? What's the research? All that is happening. So, all that
And
sort
and
of
and 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 who's your favorite coach? Who's someone that you really love and go back to?
for coach wise, or for what
Yeah,
do you
yeah,
mean?
coach. Yeah, who's your favorite coach?
Um, I don't think I have a favorite coach per se. Yeah, I don't think I have a because coaches is such a big word. Um, and kind of like everybody's a coach. So I don't know if I have a favorite. Um, but yeah, I'm gonna have to think about that one. I mean, I think I try to get a little bit of I like to get, what take what works and leave the rest. So I'm not like a blind groupie that, oh my God, everything you say is like a love. I mean, I try to get something that I like from each and kind of apply it, and what works for me and what doesn't, I let it go. So I don't really have a favorite per se. I like some things that some people say, and then I use that, and some of the stuff I'm like, oh, I don't know about that, so it just depends.
Fair enough. Fair enough. And I mean, have you been able to translate that into your clinical practice currently?
Yeah, I mean, I think I have now, since my burnout too, become like a little bit more of like a psycho-urologist, which what I mean by that is, I really just address like the elephant in the room, which is stress. And then again, I mean, I do this like all day. Like they come in and their bladder pain and this, and like it's not an infection, it's not anything else. But I'm like, interesting. So tell me, like this, oh, it started like 8 months ago. I'm like, okay, tell me more. Like, what happened maybe like right before? And then they tell me about how their business like tanked and how like 5 people in their family died, or, all these stressors that they're carrying. And, then all these symptoms started, like really right after. So then I'm like, okay, well, let's talk about that. And like, what can we do? Can we do like a mindfulness practice? Can we do gratitude? Can we go hiking? Can we walk outside? What can we do to really change things? Can you tap into your spirituality? Like, do you have a spiritual practice, and really addressing that, more than just here's your medication, see you, or here's your Botox for your bladder, see you in 3 months. So I just have changed a lot more of that. I try to address that a lot more, because again, if you don't, it just doesn't get better. People get frustrated. A lot of urologists, for example, the thing that they hate the most is like testicle pain. Like that consult for testicle pain is like, oh God, please no. Like I don't want to do that as a general rule. And I wonder like why? Well, it's because it's frustrating for us as urologists, because we're like, here's your ibuprofen, get in some warm bath, I'll see you later. And it doesn't get better. And then you're frustrated because like they're still saying their like testicle hurts and like everything's fine on like any exam you do. And so it's just disappointing. And as urologists and doers, we want like that result. We want to like, do something and make it better. Put a catheter and then you can pee, or do the surgery and you can pee. So when you don't get that like immediate gratification, everybody gets frustrated. But testicle pain, perineal pain, it's all because the muscles that hold up your bladder, your pelvic floor muscles that hold up your bladder, your prostate, they get so tense, just like if your shoulders get tense from like typing or doing that, that tension that you carry from the stress that lands and stays there, it causes the testicle pain, the penis pain, they have like bladder pain. And so you need physical therapy. Sometimes you may need like a muscle relaxant, like, vaginally or rectally if you're a man or woman. And you need to decrease the stress. And if you don't do that, it won't get better. But if you just give Motrin and warm baths, it's also not going to get better. So we got to address all these things to a deeper level to truly get, healing. And patients come also frustrated many times because they say, oh, my bladder hurts, this, that. They've done all these tests, or I have this belly pain and nothing comes up and I'm still suffering. And it's like, because it's not going to be found on a scan. This is not an organ problem that you can visibly see. This is like an energetic problem of like the stress and all that is not visible, but is really real. And so until we have maybe different tests or we're testing for something different, you're never going to find it, but it's absolutely real and it's causing you your illness and your disease.
And what's your urology colleagues' reactions to you going into the field of psychourology?
Well, I don't know if I say, oh, I'm a urologist as my practice tagline, but I don't know if I don't know if they know how I practice or don't. I mean, I just take care of patients and, this is how I practice. So, I don't know if what their opinion is about it, but whatever
it sounds
is,
interesting. It sounds interesting,
yeah.
Top and bottom coming together and, creating magic.
Yeah. So, it's like people will, whether it's that or anything else in life, people are going to have their own opinions, right? So they're going to think you're crazy. It's awesome. It's the best, whether I'm doing that or anything else in life. And so that's great. Those are like your opinions. You can keep them or you can also share them, but they don't belong to me. If they have some value, I'll listen to it and I will, explore it and take it into account. But if it's coming from some hate or some fear, like I'm not going to listen to that because it has no value. But I know that what I do is coming from love, and so then whatever I do is from love. So I'm okay, and I can go to sleep, every night, knowing that the actions I take or the things I'm doing are coming out of love. So I'm okay with whatever people say because I know where I stand in my, my thoughts or my purpose or why I do things. So I think for anybody, like, people will say all kinds of stuff because we're judging machines. Our human brain wants to judge. That's what we do. But like, take it or leave it. If it's not useful, you can just, crumble up that opinion and like flush it in the toilet.
Yeah. And you mentioned energy and I see that you're interested in Reiki practices.
Yeah,
So
there's like 3 levels for Reiki. Reiki means universal energy and it comes from Japan, and basically it just means universal energy. And there's 3 levels for it, and I've done the Reiki level 1. I'm going to do Reiki level 2. It's just about learning about energy and how like you could use that as a healing modality. So it's not like I practice this because I'm just starting to learn about it, but I think it's
finding
always
it useful.
well, I think, I think we kind of practice that without saying it's Reiki. Like you were talking at the beginning, you're there in person and you feel it, and you kind of put that healing vibration, like that healing thoughts for your patient. That's Reiki. It's like Reiki means transferring of, you're really transferring energy. You're a conduit. You're not, you're just letting the energy flow from source, from God, through you to somebody else. But we do that all the time if you truly are a healer. If you're just a technician or surgical technician or whatever, yeah, you're just like doing your right. But if you truly are trying to like heal, you do that all the time, whether you know it or not. You are sending that good energy, that healing that they want you to get better to your patients all the time, or to friends or family. We just didn't know it's called Reiki, but now if you have the language, we're like, oh, that's Reiki. So I think I kind of intuitively have done it without knowing what it is or isn't. And it's just kind of learning more things about it and, learning new skills, because like, why not? Why wouldn't I learn new things? So I find it interesting.
Yeah. For sure. I think, the energy of the room certainly plays a big part in the, in the whole consultation. Definitely. And you're quite active on social media. Where does that come from? Is it because, you are a, beautiful Latina woman and, they're quite social and out and about and just
No, I
being
think for
themselves?
me, Yeah, I mean, I really wasn't active in social media at all until like probably last year. So last year when I went through my burnout too, I used writing for my healing. So had never written anything in my life, and I decided to write in Kevin MD, which is a platform in the in the US, but it's everywhere. But where anybody in medicine can write articles and they get published. And so I wrote my first article just for my own healing. And then from there, I just started writing, many articles, in Doximity and Medscape and, in many, many outlets, just really because it heals me and it helps me process, sort of like my emotions. So if you write something you want to share with others, so then I'm like, well, then I'm going to share it on LinkedIn. I'm going to share it here. And then, I had Facebook already. So I'm like, I'll share it in Facebook. And then I got into Twitter, which I still kind of try to figure out how to use it. And then I'm like, I'm going to do Instagram because now I want to like do movement and silly dances and have a good message. And I love to dance and move. So I'm like, why not? So I just did it because that's just a way to share the things that I'm writing and share messages. And that's really the only reason. So more people can know about these things because stories are important. They bring us together. You're like, oh, I went through that too, or that was useful. And since I started physiciancoachsupport.com, which is a platform for any physician to come get support by a peer who's a life coach, it was just a way to let other people know about it. Because if nobody knows about it, nobody is going to get benefit from it. So social media has just been a way to, share what it is, share it with others, let them know it exists. So, they can come get support because burnout is real. We're all suffering and, we're depressed and apathetic and making mistakes at work because we're burned out. And so it's like, well, do something else, do something different, get support. You're not alone. You don't have to go to admin. This is confidential, so just something to do to help others. So it's just been a platform to share that, to share the writings I had, and to connect with amazing people, right? Like that's how we connected. But if I wasn't in LinkedIn, if I didn't hear a podcast you were in, we would have not connected. So I think it's just a beautiful way, and it's just a tool. You can use any tool for good or bad. You can be on Twitter and have a big fest of negativity and slash people down and tear people down, or you can use it for good. And that could be about money. You could use your money for good and do charity or help, or you could pay for a prostitute or child pornography or whatever. You use all these tools for good or bad. It's not the tool, it's how you use it. So to me, it has been, positive to connect with, amazing people. Otherwise I would have never met.
And what was your biggest sort of surprise of sort of going into that sort of aspect of social media and expressing your experiences in burnout? And
yeah, I mean, just how, you can find really amazing people. And then sometimes you can also meet them in real life, which is kind of fun. I mean, obviously we had COVID, so some people we were not as, in person, but having met them, having also seen them in person, it's just fun. And, just realize like how big, Bonita says, like your little circle and your little small world, when you open it up, it's amazing. And again, I have my podcast with Dr. Nupi Aurora, who's in the UK as well, and who would have like known that we could do it, and we do live stream, and it does not matter the time difference, because we could do this virtually. So it's just been fun. It's been very positive, but obviously there's always some dark sides. I don't think I've really experienced them yet, but I'm sure they will come. And of course, you get haters, you get people getting triggered and saying things. Well, that's
you
also
have
on
haters.
them.
Come on, you can't have haters.
Yeah, sometimes I get them. Not often, but I do. I get these haters. Usually it's women. Yeah, it's usually women that say something, and I'm like, okay, that's interesting. Okay, I hear your point. I have a
What's the
lovely
most
day.
what's the most horrible thing that they've said to you that you can share with us?
No, I mean, I write about providers. I say I'm not a provider. And because I am a physician and not a provider, and there's a whole thing you can read about why, physiciancoachsupport.com. But I had a lady on Twitter say, like, really, honey, you're gonna die on that hill or something like that. And I'm like, yeah, maybe I will. Like, like you do you, and you be passionate about your causes. I'm like, I'll do whatever I want to do. It's like, like if you have nothing uplifting to say, it's like you're like it just reflects on you. When you're not loving to somebody else, it just shows like you're broken inside and you're not doing well. Because anybody that is well, anybody that is like truly loving is not gonna say junk to like strangers on social media or anywhere. So I had that. I had another nurse practitioner, I think it was, tell me how it was revolting, it was full of ego. And at the same time, she said, I can like run laps around the physicians as a nurse practitioner and I have more experience than they. And I'm like, that's interesting. You're accusing me of ego, yet your statement is reeking of ego, saying you're better than a physician. And it's like, okay, like that's interesting. So, I mean, the stuff that I said is just sometimes it's a little funny, but I'm like, okay, that's interesting, So, it is what it is. People can say what they need to say. They need to get it off their chest. They need to like let out the hatred or whatever. At the end of the day, it reflects on who you are, not on me. So, but I will like listen to people. I mean, people have valid points. Sometimes maybe if I miss a mark, I'm like, oh, okay, maybe I could have said things in a different way or a better way. But I'm not gonna like have my life and my self-worth crumble over somebody's like hate.
And why did you call yourself the SuperNova Sisters? What's that
Oh,
about?
SuperNova. Yeah, well, SuperNova because we have a lot of energy. Nupi and I, we're just like very energetic. We're like, sometimes we get like really excited, and it's a lot about energy. Just like the physical when we get excited, and just like the deeper energy, and really about connecting your mind, body, and soul, and that's energy. So so that's SuperNova, and it's explosion. We both come together, and we're sisters because we really love each other like sisters. And physicians in motion because we're physicians and we're always like moving, and we want to move our mind, our thoughts, our body. It's about like movement and keep moving forward.
And how did you two meet together? What was the story there?
Yeah, we met on social media. So I was watching one day a podcast by our colleague Tamara Beckford, and she had on there Dr. Jeff O'Driscoll, who is a retired ER physician who is like healer, like clairvoyant. I mean, he's just an amazing person. And I heard their interview and I had never heard like a physician talk about this stuff. And I'm like, who is this man? Like, what? It was like really powerful. The story he said in the podcast was like extremely powerful. And so I was on there and I was just typing like, oh my God, like what? I can't believe it. And then somebody in the chat was also blowing up the chat saying like the same thing. And so I was like, who are you? And I was like, for Nupi. And then from there, we just connected. And I was like, I need to get to know you. And we connected and we love each other. And like the rest is history.
Have you two met sort of physically or?
No, because she's in the UK, but hopefully she'll come for her 50th birthday to the US. But she's in the UK and I'm here in Los Angeles, but hopefully we will.
So that's worth, a bit of video or some kind of content. I'm sure that'll be quite exciting to watch.
Yes, we wanna get glammed up. We wanna get in person and definitely record that for posterity. But yeah, it should be really fun.
Cool. Well, I mean, it's been absolutely awesome. Really interesting journey, and yeah, just wonderful energy. And I mean, it's a pleasure, seeing you and watching you. And I am an old man myself, so if I
love old men.
if I need any sort of urology stuff, I'd definitely be coming to you for sure.
Yeah, you come. We'll help you out.
Yeah, I want that erection to keep working, sort of thing.
Anything. We don't judge. We just help you. So, but yes, I really appreciate. I mean, I have listened to your podcast and the other interviews done and other ones, and I just love that deeper components, those deeper questions. It's just interesting. It's fun. It's important to really pause and think about that, and not just all the superficial, stuff, and just deeper. Like I think that is what feeds my soul, to speak with people that really want to dive deeper and more to medicine than just like the surgical stuff and then transcribing. So I appreciate your voice. I appreciate what you're doing. I love hearing your voice and your thoughts and your opinions about things. So I'm so grateful for.
Oh, that's very kind of you. That's very kind. I wasn't expecting that, and yeah, I mean, I certainly concur that I think the sublime and the sacred language does go a long way into sort of talking about these deeper issues. And it's a great relief. It does touch us more inside, and it allows us to connect with other people on a deeper level, and other human beings realize that, and they can feel that. And I think that's where the magic and the healing occurs. I'd like to end on sort of this question. So what would your advice be to the young Diana who's about to start medical school? What would your 3 top tips be to her, given that you've experienced what you've experienced over the last few years?
I think it's like, I mean, it's kind of what I did, but it's like, just be you, like there's no need to ever change anything. Be you. Trust your intuition, which I think I have always trusted that, like what feels, and that's mean like what feels right. It's not like thinking, like we're always thinking up here in the head, but it's like what feels right, what feels peaceful in your body. Listen to, what works for you, and, just like stay true to yourself, really. That's the major thing for me, or for really anybody. Just, don't worry what people say. It doesn't matter. It doesn't define you. You define you. You love yourself, and just keep going. Like just keep going. Stand proud. Don't shrink to, for other people. Just stand proud of who you are, because you're worthy. You're beautiful. You're powerful. Not just about me. I'm saying like about telling that to others. To believe that. To really, really believe that.
Wonderful. Thank you so much, Diana.
Thank you so much. It was a pleasure to be with you this morning and afternoon for you. Evening.